Hidalgo County is situated along the border that separates Texas and Mexico. It's home to one of the country's fastest growing but poorest populations. Largely Hispanic and Catholic, the county also has one of the highest birth rates in a state where Medicaid funds more than half of all deliveries. In the city of Mission, employees of the oldest Planned Parenthood in South Texas clear out the last of their records.
Because of the cuts to the state family planning program, we had to close 4 clinics immediately. And we may not be through with that, with the closing.
Operating in a region with a limited donor base and high number of uninsured clients has never been easy. Patricio Gonzalez is CEO of the Planned Parenthood Association of Hidalgo County. He says they've relied heavily on government funding to serve 23,000 clients annually. So when state cuts to family planning took effect in September, their network lost a $3.1 million contract. They laid off half their staff and shut down 4 facilities that served 16,000 patients. At one of the 4 remaining clinics in San Juan, news of the closures brought more than a dozen women into this classroom, all of them Hispanic, poor, uninsured, and worried for their health.
We don't have the resources to go to a doctor or to any other clinics.
In Spanish, they told us they are single mothers in need of birth control, married women who cannot afford more children. Planned Parenthood has become their safety net, a place where they can receive low-cost or free family planning services that includes breast and cervical cancer exams.
15 years ago, they detected the HPV virus here. She has to be checking regularly. Basically, we are their doctor. For many of them, this is the way also to help them get out of poverty by controlling their fertility and the number of children that they have, as well as quality of life.
The clinic does not provide abortions.
We do support a woman's right to choose, but right now that's not our primary mission. Work is to prevent them by placing women and men and teens on birth control.
What is happening in Texas is emblematic of a national trend. Unable to overturn the Supreme Court's Roe v. Wade decision legalizing abortion, right-to-life advocates have worked in recent years within Congress and state legislatures to make accessing the procedure as difficult as possible. They found many allies, especially in the GOP.
Abortions are the only medical procedure that you currently can just go in and have it done. You don't meet the doctor. He doesn't tell you your options. The state of Texas is not interested in proliferating the abortion business.
And I'm proud to fight for and was proud to sign a budget that defunded Planned Parenthood in Texas.
In Texas, lawmakers approved a measure requiring doctors to perform sonograms on women seeking abortions and to describe to them what they see and hear. They also worked to strip funding from any organization that performs abortions or refers women to abortion providers, even if the majority or entirety of its services are primary or preventive care. Elizabeth Graham is executive director of Texas Right to Life.
If Planned Parenthood divorced itself from abortion and quit doing abortion and abortion referrals, we would have no problem with the services they claim to provide to women.
Supporters of Planned Parenthood maintain that about 95% of its services consist of routine health care. Planned Parenthood clinics receive state aid in Texas by legally separating their family planning services from their abortion services, which are off limits to tax dollars. But the distinction has never been enough to appease pro-life advocates.
The legislators apparently didn't think so. And nor do I. We don't need to be subsidizing an agency that has very questionable ties. The goal is to stop funding the abortion industry and to help women choose life.
In order to tighten Planned Parenthood's purse strings, the legislature cut the state's family planning budget by $73 million over the next 2 years, a 66% reduction. The money was diverted to other causes, including autism and early childhood programs. Lawmakers ignored their own budget analysts' warnings that reducing family planning access would affect at least 180,000 men and women each year and could lead to more than 20,000 additional babies being born at a cost of more than $200 million. Planned Parenthood reports 66 of its Texas clinics remain open, but hours and educational outreach efforts have been cut back. Last year, 40 clinics received state support. This year, 11 do. Anti-abortion activists say the women who have relied on Planned Parenthood can go to federally qualified health centers, community clinics, and crisis pregnancy centers.
A lot of that money was, in fact, going to agencies that promote and provide abortion, including Planned Parenthood. They're out of the picture. And now these other agencies can absorb the money that is left over.
The reality is, 56 state family planning contractors are trying to split a fund that's a third of what it once was. Lone Star Circle of Care, a federally qualified health center with locations throughout Central Texas, received some funding through November, but not enough to cover their patients' demands for birth control and testing.
We're talking about more the ability for women to get preventative services. It's not so much about the reproductive health and the concerns that are associated with that, but we're talking about basic primary things that everyone should be entitled to, that it really shouldn't be attached to any political or religious agenda, you know, in that respect.
Back in Hidalgo County, Gonzalez says he is most concerned clients will have to travel longer distances for care or will stop seeking treatment altogether.
What is the reason we don't go? Because we can't afford it.
62-year-old NIDIA Torres of San Juan started coming to Planned Parenthood when she was 15.
Years ago, they found cancer in me, but it was at the proper time, and that was frozen. And that's why I'm a volunteer for the rest of my life if I have life. I am not with abortion myself. I wouldn't want to have one of my grandchild. If he's here, I'd love to see him. But if I can avoid it with a pill, with something else that they can protect themselves, I want that. Grandchildren, there'll be a time. But there's a time that we can't afford them.
Torres is concerned that a desire to punish Planned Parenthood for its pro-choice view could have unintended consequences for the health of the entire community.
Will be worse if they take away those money for Planned Parenthood.
In what way?
The hospitals will be filled. We'll have more children. We'll be needing more food stamps. We'll be needing more WIC. But this is not what the Valley needs. This is not what our community needs. This is not what Texas needs. Texas needs, it's a prevention.